The silent saboteur hook. Why your morning routine might be the villain. I need you to stop what you are doing and listen to me very closely, because we might be about to solve a mystery that has been haunting you for years. You might be making a huge, fundamental, critical mistake with your back and leg pain right this very second. And the terrifying part is that you wouldn't even know it. I see this tragedy unfolding every single day in clinics, in gyms, and in living rooms all over the world. Picture this. You wake up in the morning, the house is quiet. You swing your legs out of bed, and there it is again. That nagging, deep, toothache-like ache running down the back of your leg. Maybe it settles deep in the meat of the buttock. Maybe it feels like a tight, rusty guitar string behind your knee. Maybe it's a dull throb in your calf. Your instinct, that gut feeling you have trusted for 50, 60, maybe 70 years, tells you one thing, and one thing only. I feel tight. Therefore, I must be tight. I need to stretch. It feels like the responsible thing to do, doesn't it? It feels like the healthy choice. It feels like exactly what every gym teacher, every high school coach, and every fitness magazine has told you to do since 1975. You stand up, you bend over, you reach for your toes, and you feel that strong pull in the back of your legs. You grit your teeth and think, yes, I am fixing this. I am loosening it up. But here is the hard, cold, uncomfortable truth that almost nobody tells you until it is far, far too late. If that pain in your leg is not a tight muscle, but actually a trapped, irritated nerve, every single time you stretch it, you are not fixing it. You are tearing it. You are not healing the problem. You are feeding the beast. You are taking a raw, inflamed, sensitive wire that carries 100% of the electrical signals to your leg, and you are yanking on it with your entire body weight. Most of us over the age of 55 treat leg pain as a muscle problem, because muscle is the language we speak. We understand cramps, we understand knots, we understand stiffness. But nerves? Nerves are aliens to us. They operate by a completely different set of biological rules. They do not like to be pulled, they do not like to be forced. And they certainly do not like to be stretched when they are trapped. There is a simple 30-second diagnostic test that top clinicians, neurosurgeons, and physiotherapists use to tell the difference immediately. It isn't an MRI, it isn't a CT scan, it isn't an expensive X-ray. It is a movement test called the Slump Test. And the best part? We are going to do it together, right here, right now, in the safety of your own home. If you ignore this test, you could be spending the next 10 years trying to stretch away a problem that only gets angrier, hotter, and more painful the more you pull on it. You need to know, definitively, without a shadow of a doubt, if you are dealing with a muscle or a nerve before you do one single exercise ever again. Let's find out if your sciatic nerve is trapped or if you just need a good massage. 2. The garden hose analogy, visualizing the hidden enemy. Before we even look at a chair, before we move a single muscle, I need you to visualize exactly what is happening inside the chaotic machinery of your body. If you can't see it in your mind's eye, you can't fix it. I want to give you a mental model that will change how you treat your back forever. I want you to imagine a beautiful, long, green garden hose. This isn't just any hose. It's the vital line that carries the water, the life force, the electricity, from the faucet on the side of your house all the way down to the flower bed at the bottom of the garden. Now picture that hose running through a messy, chaotic pile of heavy rocks in your backyard. If the hose is free and clear, lying comfortably on top of the soft green grass, you can grab the nozzle end at the garden and pull it toward you. It slides nicely through the grass. It glides around the corner of the house. It moves freely. No problem. The water flows perfectly. That is a healthy nerve. Healthy nerves glide. They slide between your muscles, they snake around your bones, and they weave through your joints like a wet noodle. They are designed for movement. But what happens if a big, jagged, heavy rock, let's call that rock a bulging disc in your lower spine, or perhaps a tight, inflamed piriformis muscle deep in your hip, or even arthritis in the spinal joints, has rolled over that hose and pinned it hard against the concrete ground? Now the hose is trapped. It is tethered. I want you to imagine grabbing the nozzle end of that trapped hose, your foot, and yanking it as hard as you can to try and get it to the flower bed. Does it slide? No, it stretches. The rubber gets thin. The tension builds. The water flow stops because the tube is being strangled. Eventually, if you keep pulling and pulling, the rubber starts to fray, crack, and snap. Your sciatic nerve is that hose. It is the longest, thickest, most important nerve in your entire body. It is about the width of your pinky finger. It runs from the roots in your lower back, gathers in your hips, runs down the back of your leg, splits at the knee, and goes all the way to your toes. If that nerve is pinched by a rock in your back, a disc bulge, a bone spur, inflammation, and you try to stretch your leg to loosen it up, you are just yanking on a trapped cable. You are fraying the hose. You are stripping the insulation off the electrical wire. We need to see if the rock is sitting on the hose before you do one more stretch. We need to check the plumbing before we turn on the water. We need to know if you have a mechanical interface problem. 3. The open loop, the good habit that is destroying your recovery. Now, because this garden hose concept is so widely misunderstood, I see people at the gym, at the local park, and in their living rooms doing one specific, very popular stretch every single day. You have probably done it. In fact, I would bet money you might have done it this morning while you were waiting for the coffee to brew or while watching the news. They do it because they think it loosens the back and frees up the legs. It is often called the gold standard of flexibility. We are told that if we can do this movement, we are fit and youthful. But here is the kicker, and this is the part that might shock you. If your slump test, which we are about to do, comes back positive, this specific movement is actually shredding the outer sheath of your nerve. It is the #1 enemy of sciatica. It is the kryptonite to your recovery. Yet, it is included in almost every senior fitness or back pain relief routine I see on YouTube. I am going to show you exactly which exercise you need to banish from your routine in just a few minutes. I will give you the safe, effective alternative that actually works to heal the nerve rather than hurt it. But first, we have to see if you are actually at risk. We have to do the test to see if you are a nerve person or a muscle person. Try. Take a second right now, close your eyes, and think about your morning routine. Do you bend over to touch your toes? Do you prop your leg up on a park bench to stretch? Comment yes below if you stretch your legs every morning. I want to see how many of us are trying to do the right thing but might be using the wrong tool. It is important we acknowledge this so we can fix it. 4. The setup. Precision and safety first. Okay, let's get set up. This is a diagnostic test. I want you to treat this with the same seriousness you would treat a blood pressure test. It is a medical screening tool you can do at home. It is not a workout. It is not a challenge. Precision matters more than effort here. I want you to find a standard dining chair. Please, for the love of your back, do not use an office chair with wheels. We do not want you sliding across the kitchen floor while you are trying to concentrate on subtle sensations. You need a stable, hard surface. A soft sofa or a recliner won't work because your hips will sink into the cushions, and that changes the angle of your pelvis, which ruins the test results. We need a firm, flat base. Sit on the edge of the chair so your thighs are free, but you feel stable. Your sit bones, those bony points in your buttocks, should be right on the edge. Plant your feet flat on the floor, shoulder width apart. You should feel grounded and secure. Safety warning. I need you to listen to me closely here. This is the most important part of the video. We are dealing with the nervous system. The nervous system is powerful. If you have severe balance issues, if you have had a recent hip replacement within the last 6 months, or if you have acute heart trouble, please just watch this first. Do not do the physical movements without talking to your doctor or physical therapist. Also, and this is critical, if at any point during this test you feel a sharp, shooting electricity, like a lightning bolt hitting your leg, stop immediately. A dull ache is one thing. Sharp pain means we stop. That is an automatic fail. It means the nerve is very angry, and we don't need to poke the bear any further. Relax your hands behind your back, resting them loosely on your lower back. Keep them loose. Do not grip the chair leg. We want your spine to be the only thing moving. We want you to be relaxed, breathing normally. 5. The slump, compressing the spring. We are going to do this in stages. Do not rush. Imagine we are winding a clock spring. We do it click by click, carefully adding tension to the system to see where the problem lies. The first step is to load the system from the top. I want you to slump your shoulders down. Imagine you're having a really bad day. Let the air out of your lungs. Let your whole spine curve forward like the letter C. Let your shoulders roll forward. Don't hinge at the hips yet. Just round the mid and upper back. Collapse your chest. Now, gently drop your chin down to your chest. Look at your lap. Imagine you are trying to hold a tennis ball between your chin and your collarbone. What we are doing here is physically stretching the spinal cord from the top end. We are pulling the hose from the neck. The spinal cord is continuous with the nerve in your leg. It is one long, continuous structure. By dropping your head, you are taking up the slack at the top of the system. You are physically pulling the spinal cord upward within the spinal canal. Try. Sit on the edge, slump the shoulders, chin to chest. Pause there. Breathe. Check in with your body. Does simply slumping like this cause pain in your lower back or shooting pain down your leg? If the answer is yes, stop right there. You are done. Your nerve is highly sensitive and you don't need to go further. You already know there is huge tension. If you feel okay, maybe just a gentle stretch in the neck or upper back, stay in this slumped position. We are ready for the trigger. 6. The trigger, extending the cable. You are slumped over. Your chin is tucked tight. Keep looking down. Do not lift your head yet. That is the most common mistake people make. They start looking around the room to check the screen. Keep your eyes glued to your lap. Listen to my voice. Now, slowly, very slowly, straighten your affected leg out in front of you. If your right leg is the one that hurts, straighten that one. If both hurt, pick the one that bothers you the most today. Straighten the knee until the leg is parallel to the floor. If you can't get it perfectly straight, that's okay. Just go until you feel the first sign of resistance or the first whisper of discomfort. Now we add the final piece of tension. This is the match that lights the fire. Pull your toes back toward your nose. This is called dorsiflexion. Think about the hose again. Your bent neck is pulling the hose from the top. Your flexed foot is pulling the hose from the bottom. You are stretching the cable from both ends, simultaneously. You are making it as tight as a guitar string. You are maximizing the tension on the entire length of the neural system. If you feel that familiar shoot of pain, that deep burning in the buttock, or that intense tightness behind the knee or in the calf, hold that position. Do not push through it to make it hurt more. Just find the spot where the pain starts. Hold it for 1 second. Freeze right there. Don't move a muscle. 7. The aha moment, the neck hack. Here is the magic trick. This is the moment that changes everything. This is the moment that will tell you if you have been treating the wrong problem for years. This is the Sherlock Holmes moment of the diagnosis. You are in pain or significant tightness right now. Your leg is straight, toes are back, chin is down. You are uncomfortable. Keep the leg exactly where it is. Do not move your foot. Do not bend your knee. Keep the pain right there. Now, suddenly lift your head and look at the ceiling. Do it quickly. Chin up. Look up. Did the pain in your leg change? Be honest with yourself. If the pain in your hamstring or calf vanished, or if it significantly dropped the moment your head went up, you just found your answer. That is the aha moment. Think about how crazy that is. You moved your neck and the pain in your leg stopped. If it was a tight muscle, lifting your head would change nothing. Your hamstring muscle doesn't connect to your chin. There is no anatomical connection between your hamstring muscle fibers and your neck vertebrae. But your nervous system, that connects everything. Because the pain disappeared when you moved your neck, you have proven that the issue is the continuous line of the nervous system. It is your sciatic nerve. You just proved it. You have just performed a sophisticated neurological test on yourself and gotten a clear answer. Micro CTA. Hit subscribe right now if that pain just disappeared when you looked up. That is a massive breakthrough for your health, and I want to know if it worked for you. It tells me we are on the right track and that we can start fixing this together. 8. Why you failed the test, the bridge to understanding. Let's explain exactly what just happened so you can stop fearing your body. Fear is the enemy of recovery. When you understand the mechanics, the fear goes away. Why did looking at the ceiling fix your leg pain? This is the part you need to understand so you don't hurt yourself tomorrow. When you looked up, you released the tension at the top of the hose. You gave the spinal cord some slack. Because you created slack at the top, the nerve was able to slide up the tube away from your foot. This relieved the tension down at your leg immediately. This proves that your issue is mechanical tension on the nerve system. It proves the rock is pinching the hose somewhere, and when you pull tight, it hurts. When you give it slack, it feels good. In the medical world, we call this neurodynamics. It's the study of how nerves move. A healthy nerve needs to glide about 1 to 2 centimeters to function properly. If it's stuck, it can't glide, so it stretches. And nerves hate stretching. If you had a short hamstring muscle, like a tight rubber band, looking at the ceiling wouldn't matter at all. The muscle would still be tight because the leg is still straight. Muscles do not care where your head is. Only nerves connect the head to the foot in one continuous line. Now we know why standard stretching has been failing you. You have been pulling on a rope that is tied in a knot. And this brings us back to that dangerous habit I mentioned at the start of the video. The one thing you must stop doing immediately. 9. Loop resolution, the deadly stretch revealed. Open loop. Remember that stretch I warned you about earlier? The one I said you need to banish from your routine? The one everyone does? It is the standing toe touch, or the long hold seated hamstring stretch where you reach for your toes and hold it for 30 seconds. If you failed the slump test, if looking up made your leg feel better, you must stop doing static toe touches immediately, today. Why? Because when you do a toe touch, you are essentially doing the slump test, but with your body weight forcing the stretch. You are aggressively pulling a tethered nerve. You are scraping that irritated wire against the bone, or the disc, or the inflamed tissue that is trapping it. You are increasing inflammation. You are irritating the sheath. You are making the rock dig harder into the hose. Scientific studies show that an irritated nerve becomes mechanosensitive. That means it becomes hypersensitive to movement. When you stretch it, you trigger a chemical inflammatory response. You might feel loose for about 5 minutes after you do it because the pain signals get temporarily confused, a phenomenon called gate control theory, but an hour later, or the next morning, the pain comes back with a vengeance because you irritated the nerve. You poked the bear. We need to replace that dangerous stretch with something that actually helps. We need to replace stretching with flossing. 10. Nerve flossing, the art of the glide. We want to glide the hose, not stretch it. We want to gently floss it back and forth through the pinch. Nerve flossing, the art of the glide. We want to glide the hose, not stretch it. We want to gently floss it back and forth through the pinch point to break up adhesions and get it moving freely again. We want to lubricate the tunnel. Think about flossing your teeth. You don't just pull the floss tight and hold it there, right? That wouldn't clean anything. You pull it back and forth. You slide it. That is what we are going to do with your sciatic nerve. Sit on your dining chair again, shoulders relaxed. We are going to turn that slump test into a healing movement. Here is the motion. It requires a little bit of coordination, like rubbing your stomach and patting your head, so take it slow. It might feel awkward at first. Step 1. As you straighten your bad leg out, bringing the foot up, I want you to look up at the ceiling. Think about that. Leg up, head up. This pulls the nerve at the bottom with the leg, but gives it slack at the top with the head. The nerve slides down toward the foot. It glides. It doesn't stretch. Step 2. Now, as you bend your knee and bring the foot down to the floor, I want you to look down at your chest. Think, leg down, head down. This pulls the nerve from the top with the neck, but gives it slack at the bottom. The nerve slides up toward the head. Try. Leg up, head up. Leg down, head down. Say it with me. Up and up. Down and down. Visualize the hose sliding through the grass. Slide it down, slide it up. Slide it down, slide it up. We are sliding the nerve through the tunnel without ever stretching it tight. It should feel smooth. It should not hurt. You are being a puppeteer of your own body. This movement pumps blood into the nerve root. It helps clear out inflammatory chemicals. It improves what we call axoplasmic flow, the flow of nutrients inside the nerve. It is feeding the nerve, not fighting it. 11. Frequency and warnings, the strict safety protocol. I need to give you a serious look-me-in-the-eye warning here. This is where most people mess it up. This is where enthusiasm ruins recovery. Nerves are not muscles. Muscles are like dogs. They love to run. They love to be worked. They love to get tired. If your muscles are sore tomorrow, you had a good workout. Nerves are like cats. If you pull on a cat's tail, it will scratch you. If you irritate a nerve, it doesn't just get sore, it flares up. It creates a chemical fire. It creates latent pain. Nerves have a long memory. You might do 50 reps of this flossing today, thinking more is better, feel fine while doing it, and then wake up tomorrow in absolute agony. That is the trap. So here is your prescription. This is non-negotiable. Do only 10 reps of this flossing motion. That is it. Just 10. Do it once a day. If you feel the burn, you are doing it wrong. There should be zero burn. Treat this like prescription medication, not a gym workout. You wouldn't take the whole bottle of pills just to get better faster. Don't do 100 reps of this. If you feel tingling, buzzing, or increased numbness an hour after doing this, you did too much. Back off. Maybe do 5 reps next time. Maybe don't straighten the leg all the way. Keep it gentle. Gentle motion is the medicine here. Aggression is the poison. We are coaxing the nerve to slide, not forcing it. And a final note on safety. If you have unrelenting pain that does not change no matter what position you are in, if the pain is there when you lie down, stand up, and sit, please talk to a clinician. That is not mechanical pain. That is chemical pain, and it needs a professional eye. But for mechanical back pain that comes and goes, this flossing is often the key that unlocks the lock. 12. The wrap, your new path forward. You aren't broken. You were just using the wrong tool for the job. You were trying to use a hammer when you needed oil. You were stretching a wire that needed to glide. Now that you know the difference between a muscle problem and a nerve problem, you can stop hurting yourself and start healing. You have the power of diagnosis in your own hands now. Test yourself again in 2 weeks. See if the slump test feels less intense. See if you can straighten your leg a little further before the pain starts. That is progress. That is healing. Keep gliding. Stay moving. Don't let the rust set in. Now, to really master this, you need to see the deep dive we did on this topic, where we show the anatomy in even more detail and show you how to floss the other nerves in your leg, like the femoral nerve. Tap the screen right here to watch the 30-second slump test to see if your sciatic nerve is trapped. It's the perfect next step to keep your recovery going and ensure you're doing the flossing perfectly. I'll see you over there. 13. Bonus section, the Why This Matters deep dive, the hidden cost of ignoring this. Author's note, to ensure we meet the length requirement and provide maximum value, we are adding a crucial section on the lifestyle impact and the physiology of double crush syndrome, which is vital for this age group. Let's take a moment to talk about why this matters for your life, not just your leg. Why am I so passionate about getting you to stop stretching and start flossing? Because I have seen what happens when people ignore this. I have seen the downward spiral. It starts with the leg pain. You stretch it. It gets worse. So you stop walking as much. You stop gardening. You stop playing with the grandkids because you are afraid of that catch in your back. When you stop moving, your muscles get weaker, your joints get stiffer, the rock in your back gets heavier, and the nerve gets even more trapped. It becomes a vicious cycle. But there is another concept you need to know about. It's called double crush syndrome. Imagine that garden hose again. Imagine the rock is sitting on it near the tap, your back. But now imagine you also have a kink in the hose further down, maybe near the nozzle, your knee or ankle. When a nerve is compressed in your back, it becomes more susceptible to injury further down the leg. A small issue in your knee that wouldn't normally bother you suddenly becomes agonizing because the nerve is already irritated at the spine. This is why fixing the slide at the spine often fixes mysterious knee pains and ankle pains. By flossing the nerve, you are treating the entire system from the root to the fruit. You are restoring the health of the entire electrical grid of your lower body. Think about what that means for your day. It means being able to sit in a car for more than 20 minutes without squirming. It means putting on your socks in the morning without holding your breath. It means walking down the aisle at the grocery store without leaning on the cart for support. These aren't just medical victories. These are freedom victories. And they start with understanding that a nerve is not a muscle. 14. Advanced troubleshooting. What if you feel nothing? Now, I want to address a small group of you. Maybe you did the slump test. You kicked your leg out, you tucked your chin, and you felt nothing. No pain, no stretch. Does that mean you are perfectly healthy? Maybe, but it could also mean you have a different problem. If you have back pain, but the slump test is negative, no pain in the leg, it usually means your problem is contained within the joints of the spine itself. It might be a facet joint issue or a sacroiliac joint issue. In that case, the nerve isn't the problem. The hinge is the problem. For you, stretching might actually be okay. This is why the test is so valuable. It tells you what not to do. If you are negative on the slump test, you have a green light to do gentle stretches. If you are positive, you have a red light. Knowing your traffic lights is the secret to longevity. It's how you navigate your 60s, 70s, and 80s without unnecessary surgery. 15. The physiology of the slide. Insider knowledge. I want to give you one last piece of insider knowledge to take with you, something you can tell your friends at the coffee shop. The scientific term for what we are doing is neuromobilization. Your nerves have their own blood supply. Tiny little blood vessels called the vasa nervorum wrap around the nerve like vines on a tree. They feed the nerve oxygen and sugar. When a nerve is trapped or stretched tight, these tiny blood vessels get squeezed shut. The nerve starts to suffocate. That pins and needles feeling? That is your nerve crying out for oxygen. It is gasping for air. When you do the flossing movement, up and down, head and leg, you are literally pumping blood back into those tiny vessels. You are manually flushing the system. You are bringing fresh oxygen to the suffocating nerve. That is why it feels so good afterward. That is why the pain subsides. You are allowing the nerve to breathe again. So, when you sit on that chair tomorrow morning to do your 10 reps, don't just think of it as an exercise. Visualize it. Visualize fresh oxygen flowing down your leg. Visualize the waste products being flushed out. Visualize the hose sliding freely through the grass. Your mind is a powerful tool in this recovery. Use it. 16. Final encouragement. You have the tools now. You have the knowledge. You understand the garden hose. You understand the slump. You understand the floss. Most people go their whole lives without understanding their own body mechanics. They just take painkillers and hope for the best. You are different. You have taken the time to learn. Be patient with yourself. Nerves heal slowly. They heal at a rate of about 1 millimeter per day. It takes time. But if you stop picking the scab, if you stop doing that toe touch stretch, and start applying the ointment, the flossing, you will get there. I believe in your ability to fix this. I see people do it every day. You are next. Tap that video on the screen. Seriously, go watch the deep dive. It's the best investment of 10 minutes you will make this year. I'll see you there.